Hey friend, what if I told you you can have spinal stenosis relief in 30 seconds? Join me today as I walk you through exercises you can perform at home that will give you relief from your lumbar stenosis. Here we go. Welcome back friends, Dr. Josa here to help you move better and feel better. Thanks for tuning into the show today. And if you're new to the channel or haven't already, make sure you hit that subscribe button so you don't miss it on future videos. Lumbar stenosis occurs when there's narrowing in the spine. With old age, arthritic changes, bone spurs, and sometimes disc herniation and disc bulging, this can cause less space in the spine, causing irritation and compression, which can cause symptoms into the legs. Common complaints with lumbar stenosis include difficulty standing and walking, with pain and symptoms in the back that can travel into the legs. A common relieving position for lumbar stenosis is in the seated position. In this position, our lumbar spine is flexed, opening up our lumbar spine, relieving the compression on our nerves and tissues, and relieving those symptoms in the back and into the legs. Today, I'm going to walk you through effective stretches and exercises that will quickly give you relief from your lumbar stenosis. The first and best stretch is a single knee to chest stretch. This is a 30-second stretch that's going to give you immediate relief of your stenosis symptoms. For the single knee to chest stretch, you're going to be lying on your back. One leg you're going to pull up while the other leg is straight. You're going to pull that knee up to your chest and hold that 30 seconds. This is going to open up the low back, decrease that irritation and compression on your low back to reduce those symptoms from your back traveling into the leg. And then you can perform on the opposite leg. Same idea, pull that knee up to your chest, hold that 30 seconds, and then you can perform 2 to 3 sets on both sides to quickly give you relief from your lumbar stenosis. And if you're able to, you can progress the single knee to chest stretch to a double knee to chest stretch. So same position, laying on your back, you're going to pull both knees up to your chest to open up that low back. Hold that position 30 seconds, and then you can perform 2 to 3 sets to open up that low back to decrease those symptoms into your legs. Another great exercise in the clinic I use for lumbar stenosis is posterior pelvic tilts. This exercise not only opens up the low back for your nerves and tissues, but also gets your core activated to improve strength in your midsection to provide more stability for your back. For the posterior pelvic tilts, you're going to be lying on your back with your knees bent up. You're going to focus on driving your pelvis back into the table or floor. Hold that position 5 seconds and then relax forward. You should feel your pelvis drive back into the table or floor as your back flattens out. So continue with 15 reps with that 5-second hold, up to 2 to 3 sets to perform those posterior pelvic tilts. If you're unable or having difficulty getting on your back for the single knee to chest stretch, I have a variation in the seated position you can perform to open up your low back to reduce those symptoms from your stenosis into the legs. So in the seated position, you're going to work on seated lumbar flexion. You're going to bend forward and reach towards the ground as far as you can slowly. Once you get as far as you can, I want you to hold that position 5 seconds to start with, and then come back up to the seated position. Continue with this exercise for 10 to 15 reps with that 5-second hold to open up your low back, reduce that compression and irritation from the low back and into the legs to help quickly improve your lumbar stenosis symptoms. Thanks for watching today. Perform these exercises to give you fast relief from your lumbar stenosis. If you found today's video helpful, click the like button and comment below, and I'll see you on the next video. I'm Dr. Josa, helping you to move better and feel better.